Founded by Dr. Joseph D. Giovinco, an Atlanta podiatrist, the IIFAS continues to freely offer citizens of the world the same standard of podiatric medical care as their United States counterparts. The nonprofit organization arrived to this native country equipped with over $25,000 worth of corporate and privately donated medical hardware and supplies. With the assistance of local supporters, the campaign was able to transport across the country toward the town of San Miguel. It is here that the campaign members lived with local family of Dr. Salvador Perez, who is the chief of surgery at the Hospital for Nueva Guadalupe. Collaboration between Dr. Giovinco and Dr. Salvador Perez resulted in an organized team of 17 volunteers, which included both American podiatrists and El Salvadorian surgeons. To start the campaign, this mission made an initial excursion to several rural villages embedded along the countryside of El Salvador. This leg of the campaign provided members of the mission team an opportunity to offer in-home care to some of the more remote and financially burdened citizens. The next stage of the campaign took place at the Hospital of Nueva Guadalupe. Here the campaign utilized the hospital's clinical quarters and services to evaluate and treat over 100 individual patients who were able to make the long pilgrimage. Although these patients presented with a variety of conditions, the overall population of El Salvador is without proper podiatric medical care. This results in an unfortunate number of people and children with neglected deformities and post-traumatic ailments. Children with congenital deformities were evaluated for treatment by means of gait analysis and physical examination. If left untreated, one can see how these imperfections not only affect the biomechanical function of the body, but can compromise the patient's overall quality of life. Based on age and severity of the underlying condition, some of these patients were able to begin a serial casting regimen. This is a method used to correct a young child's clubfoot deformity, whereby a gradual sequence of reduction is utilized before the foot becomes ossified and rigid. For patients who possess neglected or severe deformities, surgical treatment was offered. This took place in the hospital's operating rooms, where team members worked side by side with resident doctors to provide an uncompromising standard of medical care. Through hours of tireless effort, the 2008 IIFAS campaign was able to surgically adjust more than 24 complex and immobilizing conditions. This involved a variety of high-caliber surgical procedures and techniques to restore and improve function to the feet and legs of El Salvador's citizens. The IIFAS has many goals, aside from providing the impoverished with high-quality podiatric medical care. The central mission of the Institute is to empower indigenous healthcare providers to offer the same level of care for themselves through education and training. This continuing effort is made possible by both the local ancillary services offered by the Hospital of Nueva Guadalupe, as well as the overwhelming support of local residents and hospital staff. In addition to volunteer translation service and medical assistance, these local citizens also provide travel and housing arrangements for the campaign members. This integration and cooperation with the native cultural community remains an important touchstone of the IIFAS. It is a vital component in the effort to achieve a lasting relationship with the people of the world around us.